Hello everyone, good morning. Am I audible and visible? Okay, so all right. So good morning. Welcome to NEET PG episode where we are going to look at PSM PYQs, guys. We will be targeting 15 to 20 PSM MCQs, okay, for your upcoming exams. All right, everybody. Okay. So happy Republic Day to everyone. I hope that I'm audible and visible. Okay. PDF of today will be shared on the Telegram group. Okay. So happy Republic Day, everyone. And let us start with this session. We'll be targeting 15 to 20 PSM PYQ today. Okay, everyone. Okay, I'll see, Sajal, what can be done. Okay, right now we have to take classes on YouTube. So that is why we've put out here. But we'll see how we can proceed on the app also. Okay, for one class, we can have it on the app. I'll check with the team. Okay. All right, so before we begin, please remember we have also at Unacademy started the NEET PG Vitals, where recorded videos for comprehensive NEET PG preparation is now available. The special launch price is 11,999. Now, everybody, you're getting 800 plus hours of recorded classes by your wonderful educators across all the 19 subjects. Okay, so this is one offer which is currently running on Unacademy platform. Also, we have started the last leap marathon batch, which has started on for January 22nd for 1 month. It's at a price of 3199. You can use my code PSM10 and avail any of this offer. The voice is now okay, everyone? Okay, now is the voice clear? Okay, I think it should be clear by now. All right. Also, there is the Republic Day offer which is going on. Okay, which is save up to 20% off on all your medical PG subscription. This is valid till 28th of January, guys. So any subscription that you take on an academy platform, you'll get 20% off on that. You can use code PSM10 for that as well. Plus, you will get free notes worth 7,500 with 1 year and above combo. So those are the offers that we have currently. It'll get better, Smita. Just give it a while, dear. Okay, so these are the offers that are currently running on Unacademy platform. So with any of the subscriptions that you take currently, you'll get 20% off. Let us now proceed. So what is the answer to this question? Study is done on a group of children. This is a very important PYQ. We have discussed how to go about or how to approach this question in our previous classes. So can you tell me the answer to this? Study is done on a group of children to check seasonal variation of SIDS in summer season from June to July and from August to September in another group with similar characteristics from same area. Which test will you use to compare the data? So what is the topic that we are referring to over here? Okay, think and give your answer, guys. We are referring to the topic of tests of statistical significance. Okay, so that it is of two types, parametric and non-parametric. Okay. So what is the answer over here? What are you talking? Are you talking about quantitative variable or are you talking about qualitative variable? What are you talking about? Quantitative variable or are we referring to a qualitative variable, guys? सबसे पहले you have to figure out that. So here we are referring to SIDS. Now if you talk about SIDS, everybody, can you express SIDS in mean and SDs? Is it quantitative? No, either a baby is going to have SIDS or a baby will not have SIDS. So SIDS, everybody, is a qualitative variable and this will be expressed in terms of percentage and proportion. So whenever you have a qualitative variable which will be expressed in terms of percentages and proportions, which test you have to use? You have to use a non-parametric test. And which is the most important non-parametric test that we know over here? Now, paired t-test is parametric, gone. ANOVA is also parametric. I've told you all alphabets are parametric. ANOVA, t-test, z-test. And now here we are going to have two columns, okay? Whether SIDS is there, yes, no. And here you are going to have June to July and August to September. So what does it become, everybody? 2 by 2. So when you have to compare percentages and proportion in two groups, which test are you going to use? Chi-square test. Very good, Smita. Very good. Healthy med talk, everybody. So all we've discussed this in our previous PYQ sessions also, that all that you need to figure out, are you talking about a quantitative variable or are you talking about a qualitative variable? If you are considering qualitative variable, you will use a non-parametric test, okay? And the most commonly used non-parametric test, everybody, is chi-square test. So your answer automatically becomes chi-square. Got it? I'll just give you an example. Suppose we had to compare, no, number of children having SIDS is not quantitative, Aman. Number of children is a frequency. Very good question. Okay. Now let me just tell you what is quantitative and qualitative when Aman is asking. देखो अमन, क्वांटिटेटिव एंड क्वालिटेटिव मतलब क्या होता है? क्वांटिटेटिव इज समथिंग दैट यू कैन measure and compare. Measure means it should have a unit. Okay, it should have a unit like weight, hemoglobin. Don't they have a unit? Yes. Plus we can compare also, Aman. My hemoglobin could be less than yours, but number of children is just a frequency. That so 10 children have SIDS and 2 children did not have SIDS. Are you understanding? So that is different. Qualitative जैसे gender. Can you measure gender in a unit? Can you measure male or female in a unit? No, we can't measure them. Can you measure blood group in a unit? No. But I can say 2 children in the class have blood group A positive. Alright, everyone, did you understand? The video is not clear? I have no idea why, but should get clear in a while. Okay, should we continue, everyone? Okay, we have a lot of questions to see. It's not clear. I don't know absolutely why, but can we continue? Okay, it'll get. I think it's visible, right? You can just you can see it. Okay. So clear, Aman, did you understand, everybody, the first question? Let's go to the second one. A child presented with pharyngitis and a throat swab was obtained and sent for culture. Swab should be discarded in which color bin? Red, yellow, blue or white? A, B, C, D. So throat swab culture, where should you discard it? Like there's a patient of pharyngitis who has come to you and you've taken a throat swab and you want to send it for culture. So yes, infectious contaminated waste, it goes into yellow color bag. BMW questions are a must. Please expect biomedical waste questions in your exams. So you have taken a throat swab, okay, and you need to send it for culture. So it becomes a contaminated infectious waste. So it will be discarded in which color bin? Yellow color bin, okay. All right, next question for the day. The formula here, the formula that was here that came in your exam was this one. Okay, so this formula is used to calculate mean, median, standard deviation or variance. What is it? This particular formula came in the exam. So what is this formula used to calculate, anybody? So this formula is used to calculate, very good, standard deviation. Very good. This formula is used to calculate what? Standard deviation. Okay. This is an important question. And there was another question once when they asked that if the sample size is less than 30, what will become the formula of standard deviation? Summation of mu I minus mu whole square by n minus 1. Okay. If the standard sample size is less than 30, then your standard deviation in the denominator would become n minus 1. So remember this. This is just a formula of standard deviation. Very, very important question, everyone. Okay. What is the formula for mean? I hope all of you know what is the formula for mean. Suppose I give you a data set 21321. Can you calculate the mean for this? Very good gaming. That's a very good thing. Okay, you should never get out of touch of your studies. Very good. Can you calculate mean for this data? 21321. What is the mean for this data? Quickly batao. Calculate the mean for this data set. 21321. What is mean, guys? So we all know mean is equal to sum of all observations. Okay, sum of all observations divided by the total number of observations. Okay, so what is the sum of all observations here? 2 plus 1 3, 3 plus 3 6, 7 8 9. And what are the total observations? 5. So you can easily get it 1.8. Can you calculate the median for the data set? 21321. What is the median for this data set? Anybody? I'm just revising the formulas. What is the median for this data set? 21321. What is the median? Very good. Please remember, median is the middle value, right? It is the middle value when data arranged in ascending or descending order, right? When data is arranged in which order? Ascending order. So let us try to arrange in ascending order. 1, 1, 2, 2, 3. Yeah. So 1, 1, 2, 2, 3. So 1, 2, 3, 4, 5. So the middle value here becomes 2. So median is equal to 2. Okay. Always remember, median is the middle value when data is arranged in ascending or descending order. And what is the mode for this data set, guys? Most frequently occurring value. Right? Mode क्या होता है? Most repeated value in a data set. Most repeated value. So which is the most repeated value? 1 and 2. ठीक है? Plus you've also seen the formula for standard deviation which came in your exam. So this is the formula for standard deviation, and if the sample size is less than 30, in the denominator it becomes n minus 1. Thumbs up everyone. Did all of you understand? Okay. All right. Can we move to the next question? Chalo. Next question. Yes. Now this is a very favorite MCQ. Yes, of course, Sajil, like I've told you before also, dear, that even if they don't give you paper and pen, that means we cannot afford to lose one easy mark. Okay. Whenever you keep practicing numericals, and whenever you get a numerical, just remember that you have to think that do you know the formula? Yes, if you know the formula, try to solve it. Every 2 days, keep practicing one numerical. Can you do that, Sajal? Okay, never say that you will not concentrate on numericals. They do turn up. They can ask you the simple formula also. So easy 1 mark को हमें छोड़ना नहीं है. ठीक है, everybody? All right. Chalo, for vaccine vial monitor, identify the incorrect statement. Incorrect. Now, please don't read it wrong and mark the correct statement. The question says, identify the incorrect statement. Use the vial if inner square is lighter than the outer circle. Use the vial if inner square starts to change color but is still lighter than the outer circle. Use the vial if the inner square is of the same color as the outer circle. Discard the vial if inner square is darker than the outer circle. So what is your answer? Absolutely correct, guys. Option C. Okay, if the inner square is of the same color than outer circle, you will discard the vial. We all know this. And if the inner square becomes darker than the outer circle, then also we are going to discard the vial. Now, certain questions about VVM. Vaccine vial monitor is which principle of primary healthcare, everybody? Vaccine vial monitor is an example of which principle of primary healthcare? This is also a PYQ. It is an example of which principle of primary healthcare? Who's going to tell me? It is an example of which principle of primary healthcare? Can you tell me it is an example of which principle of primary healthcare? Very good, Rima. It is an example of appropriate technology. Then vaccine while monitor is, what does it test? Loss of potency of vaccine to heat or cold. What does vaccine while monitor test? Loss of potency of vaccine to heat or cold. Very good. Loss of potency of vaccine to heat or cold. Vaccine while monitor, dreamer. It tests the potency of vaccine if it has been damaged on exposure to heat. Okay. Plus, this is just a color sensitive, heat sensitive label which has been put. All right, everybody. What is it? It is just a heat sensitive label which has been put on the vaccine vials. Clear? Now the voice is okay? ठीक है, चले आगे everyone. Now please remember, it is inner square and outer circle. Okay, the earth is round and we are all living inside it. ठीक है, so outer circle and inner square. चलो, let's go to the next question. All are non-contraceptive benefits of OCP except, what is your answer here? What is your answer over here? All are non-contraceptive benefits of OCP except reduced risk of endometrial cancer, reduced risk of ovarian cancer, ectopic pregnancy, STDs like HIV. Okay, very good. So what is happening? Some of you are saying D, some of you are saying C also. Okay, very good. So just look at this. OCPs का non-contraceptive benefits, very, very important, okay? You will not forget to revise OCPs as well as intrauterine devices. So OCP's non-contraceptive benefits is it reduces cancer, colorectal, endometrium, ovarian, not cervical cancer, okay? Hormonal contraceptives can increase the risk of cervical cancer. Go through this table with me once. ब्लड लॉस को कम करता है, साइकिल्स को रेगुलाइज करता है, पीआईडी को कम कर सकता है, decreased ectopics does not increase ectopics. Ectopic pregnancy can occur with the use of intrauterine devices. Okay. Then endometriosis, it can decrease. Fibroid, it is it can serve of importance. Improves bone density, reduces benign breast disease. Newer improves acne and hirsutism also. All right. But obviously, OCPs has nothing to do with STDs. So what was your answer over here? All are non-contraceptive benefits of OCPs except STDs like HIV. That is not the benefit of OCPs. Clear? Everyone, did you understand this? Have a look at this table again. It can reduce the risk of endometrial cancer, ovarian cancer, ectopic pregnancy also. It can also reduce PID, endometriosis, fibroid. It can improve acne, hirsutism, not cervical cancer. Okay, it is not offering protection from cervical cancer. All right, and we all know hormonal contraceptives cannot protect from HIV or STDs. ठीक है? So this is an important table. Guys, remember, for contraceptives, you must know the contraindications, you must know the adverse events. Those are certain things which you need to remember, which we will revise in all our series. Chalo, let's figure out if you can do this. A 55-year-old man had been working in benzene factory for a long time. He left his job 5 years ago. What is the likely complication that could occur? Skin cancer, lung cancer, bladder cancer, blood cancer. Sajil, Vegas, think again. What is the mnemonic that we have used over here? How have we learned it? So most of you are getting confused with bladder cancer. No, no, no. Bladder cancer के लिए है guys benzidine. And what have I taught you? D for bladder. Okay, D for bladder. Okay, D for bladder. It's benzidine which is bladder. Okay, D for bladder. But when you talk about benzene, everybody, when you talk about benzene, guys, benzene is leukemia. Very good. Benzene is blood cancer, leukemia. A very common mistake made by everybody. Okay. When you talk about benzidine, everybody, benzidine, D for bladder. But when you talk about blood cancers, okay, or benzene, it is related with leukemia. Not option C. Bladder cancer के लिए होता है benzidine, D for bladder. But blood cancers में क्या हो जाएगा? Benzene. Okay, am I clear? Everyone, I'll show you a chart over here. Can we all appreciate this chart for a moment, guys? देखो. Now, what are the PYQs from this chart? Okay, benzene or ethylene oxide is leukemia. Okay, asbestos PYQ mesothelioma. This is the most specific manifestation. Okay, what else has come in your exams? Arsenic नहीं आया है, benzidine has come. ठीक है, benzidine, D for bladder. Okay, D for bladder. Beryllium, cadmium, chromium are not that important. Okay. PAH is a PYQ, polyaromatic hydrocarbons. This is related to scrotum cancer. This was a PYQ. Vinyl chloride, liver cancer. This is a PYQ. And expected MCQ क्या है? Expected MCQ is wood dust leading to nasal cancer. Smita, I'm really sorry, dear. I don't know why it's happening like that. If you could concentrate, if you could try to have a look, I'll get it checked later. Can we do that, Smita? I'm really sorry, dear. I don't know why it's a little this thing. I will get it checked from the next class. Okay, Smita? I'm really sorry. Okay, Abhi, I'm just reading out to you. Can you listen to me once what I'm reading so that at least it will get in your mind? Okay, then I will, from the next class that we have, I will get this checked. Okay, can we do that? All right, chalo. Don't worry, don't worry. I'll read it out to you. आप बस मुझे एक बार सुन लो, ठीक है? और अगली बार से मैं इसको देख लूंगी, ठीक है? आज के लिए कर ले, हाँ PDF मिलेगा, ठीक है? It will be available on the Telegram group. Okay? ठीक है, सो सॉरी. ओके, मैं इसको चेक कराऊंगी, ठीक है? ऑल राइट, डोंट वरी. सो व्हाट आई जस्ट सेड, अभी मैंने बस इतना बोला कि बेंजीन ल्यूकीमिया है, बेंजीडीन ब्लैडर कैंसर है, ठीक है? एस्बेस्टस मीजोथेलियोमा है, याद रखना. कुछ कुछ इंपॉर्टेंट चीजें, ठीक है? दिस टेबल विल बी अवेलेबल इन द PDF ऑल्सो, ठीक है? बस इतना याद रखो, बेंजीन इज ल्यूकीमिया. All right, and benzidine, ठीक है? Benzidine, D for bladder. So benzidine, everybody, is bladder. चलो, can we move ahead? Can we focus, everyone? Okay, चलो, okay. All right, next question. Okay, चलो थोड़ा सा और बचा है. Let's wrap up our questions and then I'll look at it from the next class. Okay. All right, chalo. Which of the following is the correct calorie requirement in 12 weeks pregnant female? Now, such a lot of confusion in this question. इसका आंसर क्या है? बोलो. Anybody? The options are 400 in first trimester, 300 in all trimesters, 400 in third trimester, 300 in first trimester. Okay, some are saying B, some are saying D. Now, guys, I'll tell you something. According to NIN, okay, according to National Institute Nutrition, okay, what does they say? They say that plus 350 calories in pregnancy. Okay, plus 350, but none of the options resemble that, है ना? According to National Institute of Nutrition, we know that it is plus 350 in pregnancy. But does any of the option resemble that? कोई भी option वो आपको दिख रहा है? नहीं. And we also say that ideally in the first trimester, no extra calorie needed. Okay, no extra calorie needed. Ideally in the first trimester कोई extra calorie नहीं चाहिए. But कोई भी option यहाँ वो नहीं दिख रहा है, ठीक है? So we will go with, look at this. All right, look at this. According to the obstetrics book, in pregnancy, calorie requirement increases. First trimester not required, so 0 calorie. Second trimester 350 kilocalories per day. Third trimester, everybody, 450 kilocalories per day. So based on this, your answer becomes option C, which is the nearest to all the other options. Okay, technically हमें पता है that NIN बोलता है, NIN क्या बोलता है कि प्रेगनेंसी में कितनी कैलोरी होनी चाहिए, plus 350 kilocalories, okay, per day. That's what National Institute of Nutrition tells us, okay. But none of the options were given that, so we are following this according to our obstetric gynae textbook. At first trimester में 0 है, second trimester में 350 kilocalories per day है, and third trimester में 450 kilocalories per day है. All right, so to be a little more specific, we are marking C. This was a controversial question, guys. 300 in all trimesters नहीं होगा, क्योंकि first trimester में अदनान extra calorie नहीं चाहिए. Okay, in first trimester you don't need to give 300 at all, everybody. Okay, ऑल राइट. फर्स्ट ट्राइमेस्टर में आपको एक्स्ट्रा कैलोरी देने की जरूरत है ही नहीं, और सेकेंड ट्राइमेस्टर में 350 दे दो, और थर्ड ट्राइमेस्टर में वी कैन इंक्रीज इट टू 450 एज वेल. सो वी कम क्लोजेस्ट टू ऑप्शन सी. एम आई क्लियर? ठीक है, सबको समझ आया? ऑल राइट, कैन वी जस्ट इग्नोर ऑडियो वीडियो फॉर अ व्हाइल? ठीक है, अभी बस मेरी बातें सुन लो, थोड़ा सा और बचा है. नेक्स्ट क्लास से आई गेट द ऑडियो वीडियो चेक. ओके प्रिया, ठीक है. सो फर्स्ट ट्राइमेस्टर कोई एक्स्ट्रा कैलोरी नहीं चाहिए, सेकेंड ट्राइमेस्टर इज 350, थर्ड ट्राइमेस्टर इज 450. all right, so that is very very important, please remember that. okay, plus carbohydrates 50%, proteins 30%, fat 20%. ठीक है. All right. So can we go to the next question? Chalo. WHO steps approach includes all except. Now this we have been revising a lot of times. In the previous sessions also we have revised it. इसका आंसर क्या है बताओ? What is steps approach? Very good, very good. It has nothing to do with therapeutic. It has nothing to do with therapeutic. In fact, this is a repeated topic. All right, it has come many times before in your exams also. This is a repeated topic. That WHO steps approach has nothing to do with therapeutic. Look at this first. This is the WHO steps approach. Can you appreciate this WHO steps approach? Okay, why was this WHO steps approach launched? This was launched for surveillance of risk factors. Okay, we were doing what? Surveillance of risk factors for NCD. What are we trying to achieve? Surveillance of risk factor. So in the first step, we are getting a questionnaire filled where we are asking about lifestyle and behavioral factors. Okay, we are asking about lifestyle and behavioral factors. In the second step is physical measurement. So we are doing what? Anthropometric measurements. In the third step, we are taking all lab investigations. But it has nothing to do with the treatment, guys. Treatment, evaluation, therapeutic management, it has nothing to do with it. Okay. So we have a WHO steps approach for surveillance of risk factors for NCD. पहले स्टेप में हम लोग लाइफस्टाइल एंड बिहेवियरल फैक्टर्स का इंफॉर्मेशन लेंगे, दूसरे स्टेप में anthropometric measurements, and तीसरे step में we are going to talk about the lab investigations. So the answer over here is therapeutic. Okay, it includes lifestyle, behavioral में behavioral, psychological, physical factors. ठीक है. So you're taking information about tobacco use, alcohol use, physical inactivity. So these are what? Behavioral risk factors and psychological factors. Okay. You are also talking about blood pressure, blood glucose, all these things. But never you're going to say that WHO steps approach is dealing with therapeutic this thing. No. Clear everyone? Can I go to the next question? Okay. Chalo. Very easy. Following admission of an RTA case, there is spillage of blood on the hospital. Which disinfectant will you use to clean the floor? It's a very common question. Tell me the answer to this. Yeah, so we all know that for small spills, okay, if we have small spills, it is 1%. Sodium hypochlorite. If we have large spills, guys, if we have large spills, okay, the value increases. It can also go up to 10% sodium hypochlorite, okay, but the answer is sodium hypochlorite here, okay. Next, global hunger index does not include IMR, under 5 mortality rate, child mortality rate, child undernutrition, or child undernourishment. I've deliberately put 5 options. Can you tell me global hunger index does not include? What is your answer? क्या हो रहा है? कुछ बच्चे बी बोल रहे हैं, कुछ डी बोल रहे हैं, कुछ ए बोल रहे हैं. Now how can you remember global hunger index? I'll tell you a story. Okay, let's try to remember a story for global hunger index. Okay, एक story याद करते हैं. All right, let me tell you a story for global hunger index. Are you ready to listen to the story? All right. Now there is this child. Okay, who is this? This is a poor, weak, street child. ठीक है, begging on the street, begging on the street. Okay, so you must have seen poor, hungry street children who are begging on the street, who are there on the street. Now how does he appear to you? He appears undernourished. Okay, he is not getting enough food. So because of that, inadequate nourishment. Okay, inadequate nourishment matlab no food supply. Okay, so he is not getting food. That comes under nourishment. His nourishment is poor, no food supply. Now, because he is not getting adequate food supply, what has happened? He will appear malnourished. Okay, so there's a table also for this. Okay, there will be undernourishment. Okay, under nutrition. Now, under nutrition कैसे होता है everybody? Under nutrition, so the child is not getting enough food supply, so he appears wasted and stunted. Okay, he appears what? Like you can see over here. All right, he appears wasted and stunted. Wasted means low weight for height, and stunted means everybody low height for age. Okay, so he appears both wasted and stunted. Finally, what is he going to happen? The child is going to die because he's not getting food, because of which he has become wasted and stunted. So ultimately, he is going to die. Die and contribute to under 5 mortality. Okay, or child mortality. Under 5 mortality and child mortality is the same thing. बिकॉज जो बच्चे रोड में आपको दिखते हैं वो सिर्फ 1 साल के तो होते नहीं, they can be up to 5 years also, so it will ultimately contribute to under 5 or child mortality, 0 to 5 years old. So global hunger index does not include IMR. Okay, is it clear? We are not separately taking infant mortality rate, we are considering only one thing, which is under 5 mortality rate. Am I clear, everybody? Will you remember this story? Just imagine a poor, weak street child who is begging on the street. वो आपको कमजोर दिखता है, weak दिखता है. Why? Because inadequate nourishment, no adequate food supply. Now, because the child has not received any adequate food supply, घर में खाने को नहीं मिलता है, बच्चा under nutrition से suffer कर रहा है in the form of wasting and stunting. All right, wasting is an indicator of everybody, again a PYQ, acute malnutrition. And stunting is an indicator of everybody, chronic malnutrition. And ultimately, this wasting and stunting is contributing to death, which is under 5 mortality rate. So what does it not include, guys? It does not include IMR. Thumbs up, everyone. Did you understand? ठीक है, I hope you were able to relate to the story. Thus, just imagine a child begging on the street. He is weak, So that is under nourishment. All right. Then under nutrition, and finally child mortality. Okay. It's the same thing written over here. Under nourishment, inadequate food supply. Under nutrition, wasting, stunting, and child mortality. चलो, a few more questions to go. Very famous. कितनी बार आ चुका है बताओ? Low air velocity is measured by. What is the answer here? Mean and expected years of schooling dreamer is knowledge index, okay, which we use in HDI now. पहले literacy rate बोलते थे, but अब हम लोग HDI में knowledge index use करते हैं, which is mean years plus expected years of schooling. I'll tell you that we have a question on that as well, okay. All right, low air velocity is now measured by, we all know, kata thermometer. Now which color is kata? Kata means a red dog is biting. Okay, so kata thermometer is thin and narrow red color bulb. Can you see this kata thermometer? Thin and narrow red bulb. Okay, thin and narrow red bulb. This is what is kata thermometer. The image can come in your exams. And what is this? This is not thin and narrow. This is thick and wide bulb. Which one is this? What is this? This is a globe thermometer. So what does a globe thermometer do? It measures corrected effective temperature or radiant heat. Okay. Corrected effective temperature, or you could also say radiant heat. Please don't get confused. Okay. Kata thermometer is used to measure low air velocity. All right. And kata is this red in color. It's like a red color thing. Okay, everybody. This is an easy question. Kata was also used to measure cooling power of air, right? Kata thermometer was also used to measure cooling power of air. Chalo, next one. Numerator in perinatal mortality is, what is your answer? Bolo Kartik, what was the question? What is numerator in perinatal mortality? What is perinatal mortality? Post neonate death with weight 2.5 kg, early neonatal death with weight 1000 grams, abortion या stillbirth. What is perinatal mortality? First thing, perinatal mortality. Now see, this is the importance that you need to know the formulas also, because that can also come in your exams, guys. Okay. So when you talk about perinatal mortality, okay, what is perinatal mortality? So this is the death beyond 28 weeks gestation, okay, plus first 7 days of life. Death 0 to 7 days of life. Okay. Death beyond 28 weeks of gestation to first 7 days of life. Multiplier is always 1000 life births. Now, when you talk about this death beyond 28 weeks gestation, if the weeks of gestation is not mentioned, मान लो 28 weeks gestation नहीं mentioned है, तो perinatal mortality के लिए you can also consider the weight of baby that should have been more than 1 kg. All right, or length of the baby should have been at least 35 centimeters. So what is the answer over here? Early neonatal death with weight more than 1000 grams. ठीक है, this is what is perinatal mortality. Okay. Any doubt in this one? It's not option D neither. It is early neonatal death with weight more than 1000 gram. Death beyond 28 weeks gestation plus first 7 days of life. Okay. Moving to the next one. Chalo. Can anyone tell me the answer to this? Brightness of a point source of light. Now look at the thing. Here it is mentioned point source of light की brightness. इसीलिए आंसर क्या होगा? Brightness of a point source of light. Point source. Now I'll tell you a story again. Are you ready to listen to a story? Let us revise this story with the. Let us revise this topic with the story. So this is your study table. ओके, दिस इज योर स्टडी टेबल. एक बार सुनो, ठीक है, ये तुम्हारा स्टडी टेबल है. नाउ दिस इज, लेट्स से, गौरी. Okay, Gauri wants to study. All right. So now Gauri has gone and switched on a light source. So when Gauri ने light जलाया, उसने देखा आज electricity घर में नहीं है. Okay, she wants to go and switch on the light, but there is no electricity. So Gauri has lit a candle. Can you see this? Gauri has lit a candle. All right. Now, what is the power of this candle? Okay, it could be said this is a light source. So what is the power of the light source, or what is the intensity of light source? सारी एक ही चीज है मतलब. Yeah, I can also say everybody, what is the brightness of light source? Okay, what is the brightness of light source? Gauri has lit a candle, so uska power, intensity या brightness, in which unit you are going to measure this? So the SI unit over here is candela. Okay, you've lit a candle, so candela. Clear? ठीक है. तुम पढ़ने गए हो PIB, yes. घर में बत्ती नहीं है. So you've lit a candle. All right. And what am I doing? Power of light source, intensity of light source, brightness of light source. Everything is the same. So this is measured in candela. Now what happens? Light starts flowing. Can you see this second diagram? Okay. Light starts to flow. So this is what? Flow of light. Flow of light is, anybody? Flux. Okay, so when you talk about flow of light, flow of light, everybody, is flux. And now it looks like the light is flowing through a tube kind of thing. Or tube matlab lumen. Okay, so flow of light, SI unit is lumen. Okay, flux मतलब flow या measured in lumen. अब क्या होता है? Light falls on this surface. Okay, light falls on this surface. This is what illuminates the surface. Illumination. Okay, illumination of surface. तुम देखो ना, whenever you switch on a light, it is falling on my study table right now, or wherever you are sitting, you can see that the light is falling on that. So illumination of the surface. So LUM की जगह you will write LUX. Lux. Okay, illumination is measured in which SI unit? Lux. Okay, instead of illumination we will say LUM की जगह, instead of LUM, measured in lux. Now the last thing is, yes, use lux. Okay, that is also illumination. Now the last thing, when the light falls on the surface, some of them will get reflected back and produce brightness. So if I only say brightness, measure of brightness, brightness का measured is lambert. Okay, brightness measure is lambert. Okay, B for B. Measure of brightness, everybody, is lambert. All right, everybody. ठीक है? Did you understand? समझ में आया? बट अगर क्वेश्चन पूछेगा ना ब्राइटनेस ऑफ पॉइंट सोर्स ऑफ लाइट, तब आंसर लैम्बर्ट मत कर देना, बिकॉज हियर वी आर रेफरिंग टू अ पॉइंट सोर्स ऑफ लाइट. इट्स पावर, इट्स इंटेंसिटी, इट्स ब्राइटनेस, दैट्स द सेम थिंग. सो व्हाट वी एम ट्राइंग टू टेल यू नाउ, जस्ट लुक एट दिस थिंग. ओके, क्या होता है? You've lit a candle, so the candle has power or intensity or brightness. Okay, that is candela. Light starts to flow. Flow of light is flux measured in lumen. It falls on the surface. Okay, illuminates it. So illumination, LUM की जगह LUX. Some of that gets reflected back, which is brightness, lambert. Clear? Lambert के लिए they will ask you like this. Okay, light re-emitted from the surface, brightness, luminance, lambert. Can you see this? ठीक है, क्या नाम है? स्मिता. स्मिता देखो, लास्ट वाला ऑप्शन देखो, लाइट री एमिटेड, ब्राइटनेस या ल्यूमिनेंस, वो तुम्हारा लैम्बर्ट हो जाएगा. व्हाट इज द अमाउंट ऑफ लाइट व्हिच इज री एमिटेड? बट ब्राइटनेस ऑफ अ सोर्स इज इंटेंसिटी, कैंडेला. फ्लो ऑफ लाइट इज ल्यूमिनस, फ्लक्स, ल्यूमन. लाइट रीचिंग द सरफेस, illumination, lux. And light re-emitted from the surface. Okay, re-emitted from surface. उसका measure है तुम्हारा brightness, which is given in lambda. Clear? But if they use the word brightness of a light source, the answer is candela. ठीक है? Chalo. Can we go to the next question? We'll just have a look at a few more. Yes. Let's do one last topic. आज के लिए बताओ इसको. Human Development Index includes all except favorite topic. ठीक है? And there's an update also. I'll tell you. This is a favorite topic of exams. बताओ. Human Development Index, very good. The answer to this is IMR, right? Infant mortality rate is a part of PQLI. This was very, very important. Okay, okay, so now let us just quickly do the difference between PQLI and HDI. First of all, remember PQLI is physical quality of life index. HDI is Human Development Index. Now, what do physical quality of life index? See, life index है ना, so we will take the life expectancy. But in physical quality of life expectancy is given at which year of age everybody looked at? 1 year. In development, we look at the development from birth. So, life expectancy at birth. डेवलपमेंट आप हमेशा बर्थ से देखते हो. जस्ट अ वे टू रिमेंबर. So life expectancy at birth. Okay. Quality of life, we have started from 1 year of life. Okay. Then second, here you have literacy rate. Here also you have literacy, but it is in the form of education index. Okay. Or we also call it as knowledge index. Okay. Knowledge index. Now knowledge index will be equal to, somebody was asking, expected years of schooling plus mean years of schooling divided by 2. Now third, physical quality of life index में ये 1 year था ना, तो infant mortality rate. There is no income that we are considering in physical quality of life index. Okay. In HDI, development cannot take place without income. So we are looking at per capita income in purchasing power parity. ठीक है. Development कभी भी पैसे के बिना हम नहीं देखेंगे. So we will include income. Development, look at it right from birth. So life expectancy at birth. PQLI में life expectancy from 1 year and infant mortality rate. There is no income over here. The value ranges from 0 to 100. Here it is 0 to 1. What is the current ranking of HDI for India, everybody? Current ranking HDI में हमारा 132 हो गया है because the score has fallen. It is now 0.633. Okay, everybody. On the app, Amulya, the first two parts were on the app, everybody. Okay, the first two app were on this video. Will do is part one. No. Part one and two I have been taken on Unacademy app, guys. Part one and two on the app. ठीक है. Will you remember this, guys? Okay. बहुत सारे countries, I'll tell you a statement. Okay, your textbook of Park tells us that Kerala has reported low PQLI. Sorry, Kerala has reported low HDI but has a high PQLI. Kerala का per capita income कम है पर quality of life अच्छा है. ठीक है. So those are also things that were said. I said 11, but you know they had scheduled the class for 10 a.m. You can look at its recorded version, NEET PG 2023. I'm so sorry. ठीक है. Okay. All right. Okay, everyone. ठीक है. So those were the questions for today. I hope you've understood, and I'm really sorry about the this thing clarity a little. I'll get it checked. Okay. Yes, the two parts are free on Unacademy app. Okay? All the links I will share on my Telegram channel, PSM with Dr. Neha. There I'm going to share all these things. Of course, Sajil, we've discussed a few questions. कल ही हमने टीबी का किया था. मैं कल फिर आपको प्रोग्राम का क्वेश्चन लेके आऊंगी, ठीक है? व्हाट इज द करंट HDI? यस, so the current ranking of HDI is 132. Okay, the score has fallen. Okay, what is written? Okay, Anisha. All right, there is also one of my updates class which is present on the YouTube channel. You can refer to that where I've shared all the updates on the Telegram group. Okay, on that. Let me finish all the 5 parts and then I'll be sharing the links of all the 5 parts together. Okay, everyone, okay? No, 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 not 0.68. Okay, all right. So once I finish all these sessions, I will be sharing the links for all of it together. Okay, everybody. See, earlier your HDI was 0.645. Okay, now the HDI has become 0.633. Okay, all right. HDI of India current rank is 132. यहाँ लिखा है मैंने, और scoring is now 0.633. Is it clear? Score night gaming. ओके, और एक बार सारे सेशंस हो जाएंगे, आई विल शेयर द लिंक्स ऑफ ऑल द सेशंस ऑन द टेलीग्राम ग्रुप, ठीक है? ओके, so I'll see you soon, everybody. Please remember, right now Unacademy is sending out an amazing offer where you will get 20% off on any medical PG subscription, so you can avail that if you want. We've also come up with the this thing, recorded session now, NEET PG Vitals. Okay, so these wonderful educators have recorded the sessions for you, 800 plus hours recorded classes. You can avail. So happy Republic Day. So update वाला class is on our YouTube channel, Dr. Neha's Community Medicine. उसमें आपको मिल जाएगा अमूल्य, ठीक है? I'll share the link on the Telegram group also. Okay, everybody, happy Republic Day. Have a good day. Keep studying, keep revising. Please look out on the Telegram groups for the link of the next classes. I will see you soon. Bye bye. Thank you so much. And thank you for the patience due to the technology issue that we have. I'll get it rectified. Okay. Thank you.